Welcome to Good Sex at NYU, a podcast about sex, relationships, health, and mental health in a sex-positive space. So if you're looking for sometimes serious, sometimes funny, and always sex-positive discussions, then you're in the right place. I'm Danielle Elliman, Associate Director of Sexual and Relationship Respect Services at Counseling and Wellness Services. I use she, her pronouns.
And I am April Fellers, a nurse and sexual health educator at the Student Health Center. I also use she, her pronouns. We are two white, cisgender, heterosexual, female-identifying clinicians, one with a medical background and the other with mental health experience, who seek to create a space that is inclusive of all identities, backgrounds, and perspectives.
Today on the podcast, we have our colleagues at NYU's Counseling and Wellness Services, Dr. McEneany, who is the clinical psychologist and assistant director of global counseling services, and Peggy Pappathomas, a psychiatric mental health nurse practitioner. Both Anne and Peggy are on our eating disorders team and are here today to talk to us about body image, eating behaviors, and sex. Can each of you introduce yourself a little bit more to our audience, maybe how long you've been in your profession and at NYU, where you studied, anything that you feel like would be helpful for our NYU audience to know about you? Peggy, would you like to start?
Sure. So I have been in the nurse practitioner space for, probably about 4 years now. And prior to that was a registered nurse. In terms of my psychiatric mental health nurse practitioner background, I have been at NYU for almost a year now. And prior to that, did mostly consult liaison work at the Children's Hospital of Philadelphia with a lot of individuals ages 5 to 25. So not unlike our NYU population on that later half. And my predominant niche there was in eating disorders, and so mostly inpatient eating disorder work.
Okay, great. Thank you.
So I'm a clinical psychologist, and I have been working with eating disorders since my internship, which was about 30 years ago. Mm-hmm. And I've been at NYU running the eating disorders team for 18 years. And before that, I did the same at Columbia University's counseling services, and before that at Rutgers University. So I've worked in college mental health, doing a variety of things, but always working with eating and body image concerns.
Yeah, a lot of expertise in the room. So thank you so much. Can you tell us what really got you interested in working with folks who, experience eating disorders?
Sure. I'll start with that. I mean, I think, frankly, we live in a culture that has a lot of eating disordered attitudes, and that makes it really hard for people to have a good relationship with their body. Mm-hmm. So I think it's really important to send positive messages about that and help people sort of navigate how to build a healthy body image and relationship with their bodies and enjoyment within their bodies. And I have appreciated doing that in my work.
Yeah.
Yeah. And my initial introduction to eating disorders was actually when I worked in a pediatric ICU as an RN, in which you sort of see the worst manifestations of eating disorders. So cardiac arrest, things that, sort of top-down approach. And so when I went back for my psychiatric mental health program, I actually specified that I would like additional clinical work in eating disorders, and so did additional rotations at both Princeton Penn Medicine on their eating disorder unit, and then also at Renfrew's partial program for eating disorders. And so really tried to get a better understanding of how you can catch eating disorders from a pre-hospital approach, if you will. Mm-hmm. And that really sparked my love of the work.
Mm-hmm. Yeah, I think kind of what you were saying, Anne, I think body image and relationships with food touch every single person in the world, regardless of whether somebody is considered to have disordered eating or less than stellar relationship with food. And I'm curious if you could talk about some of the ideological, institutional, internalized oppressions that you see come up in your work, and either with students or just kind of in this work in general related to body image and relationships with food, and kind of how that has evolved over time or what's been consistent over time.
Yeah. Well, it kind of makes me think about the word healthy and how that is used in our culture, because I so often think that we live in a culture that I think often sends us the message that you can tell someone's health by looking at them. And the criterion that used is something, a body size, which is not healthy actually for most people and not natural for most people. So, and that applies to eating and food as well, because a lot of times when students come in who have eating concerns, we'll ask them, tell me how you eat. And if someone says I eat healthy, my next question is, well, what does that mean for you? Because often what I will hear is things like, I don't eat any fat. And I will be like, I'm not a dietitian, but I do know from working with them that, about 25% of your calories should come from fat, because some of our organs need it to work, our hair, our skin, we need it to function as a healthy organism. So I guess, I just think that so many of the ideas, and this has been true forever. I mean, like famous diets that are essentially instructing people to become eating disordered, which have sold hundreds of thousands of books. And, and that's been going on for 40 years, probably. So I think just sort of looking at the ideas that we use about health is really important, about eating, about bodies, about sexuality, too.
Yeah. And how fluid some of those ideas can be about what constitutes sort of the look of the moment. And so often you'll see a lot of disordered behavior around whatever it may be. If in the 90s it's one look and in the early 2000s it was another, a lot of, our clients, our patients end up in a space where, they're always trying to achieve a look that feels out of reach, because it might be extreme thinness, it might be extreme curviness, and yet the morals surrounding it are always changing, and so it always feels sort of like a lose-lose.
But the tie that I am hearing there is the where people are getting these ideas of quote unquote perfect image somewhere, oftentimes media, friends, family. Those are those are institutions. Those are structures outside of us, and I think that that's important to name that. While there are some constants and some things that are changing, like we're always influenced by what's around us, and then people carry with them. I think when you talk about families, children watch their parents. Watch if mom is dieting, or if dad doesn't eat specific foods because of his health, like those kinds of things kids internalize and then take with them. If a parent says something to a child about their weight or things that they're eating, that's also something that they carry with them. They get
bullied as well. Like I hear, a lot of students coming in with like being bullied for, how they look, or, again, it's not like to a certain standard that, their culture, their community is upholding for them, and, just how that impacts them, in the long run as well. So,
Sure.
So how do you help students kind of unpack those oppressions that they've received from the outside or are still in them internally?
Well, we sort of ask them to explore what they're carrying from whatever experiences they've had, and I'm not shy to name the fact that we live in an eating disordered culture, that the beauty ideals that are typically espoused are often not only sexist but racist and really problematic. So, to sort of name that very clearly right from the get-go, and then let people explore how they've impacted them, if they have, and what they have taken in from that, wherever it may have come from, because it comes from both overtly with sort of things that people say to them, but it also comes just in the fact of who's on television, who's in the media. Like if only one image is there, that sends a powerful message that people may take in a very profound way without ever having had it put into words. So just to sort of give people an opportunity to think about and kind of challenge those ideas as they've gotten in.
Yeah. And I think that should go for like all different types of providers, no matter what your specialty is.
Absolutely.
Really unpacking some of those messages. Because, I also heard you say in there like that intersectionality of different issues that come up, not just with eating, but with race, with, sexual orientation, with all these different messages gender, absolutely, that we're getting, and how they like, interconnect with each other, just like, sex. Like we have a lot of messages that are negative around sex and how it relates to body. Like, I have friends who'll be like, well, I have to lose 10 pounds before I get like on the dating app again, and you're like, really?
Right.
Okay. Like you do you, but like, I feel like there's this pressure of like, I have to be my, best image of myself before I can like, go out there and have sex or go out there and like date and, be seen as worthy or lovable. And I think that that's a misconception that, people have out there.
Right. Yeah. I mean, one of the things I sometimes say to people who are having that sort of a struggle is, well, can we think about that for a minute? Do you want a partner who would only want you if you were 10 pounds less than now? Like, what about that part of it?
Yeah.
The conditional aspect.
Yeah. And these oppressions that we're talking about, these institutional oppressions, don't just affect the person receiving these messages, right? If you're on a dating app, the person you might be pursuing may also hear those messages and not be willing to take a chance on somebody because they don't meet the quote unquote ideal standards of bodies that is being portrayed in the media as well. So that it's affecting everybody, even people who are not directly feeling the impact of disordered eating.
Yeah, absolutely.
Well, even in like harmful relationships, ones that are like maybe on the abusive side of things, right? Like having someone, demand that you keep a certain weight or only have control over, certain foods, like, right? There's a controlling aspect of that, I think, in some relationships as well, because I want, a partner who looks like this, right? And so there can be, other people involved in some of that, harmful behavior as well.
Sure.
Yeah.
So we've talked a little bit about kind of everybody having to think about and deal, we all have to eat to survive. And so, trying to figure out what to eat for dinner is one of my least favorite conversations in the world. But, I'm curious if you could share some specific definitions with us of what an eating disorder, what is specifically classified as an eating disorder, and maybe some other terms that might be familiar, like anorexia or bulimia, and other definitions that might be helpful for listeners.
I mean, one of the things that I always talk to some of my students about is two concepts, the concepts of sort of flexibility and functioning. And so when we look to, contextualize eating disorders, we have our DSM-5 criteria, right? So, for anorexia and bulimia, there are specific criterion. Anorexia is a predominantly restrictive disorder. So someone who is restricting their caloric intake, restricting their nutrition for the purpose of losing weight or altering their body shape. Bulimia mostly deals with individuals who binge and then purge, and that purging may be a compensatory mechanism to rid themselves of the food. So that may be things like laxatives, that may be things like overexercising, vomiting. Anorexia can have a binge purge component, but the predominant nature of it is restrictive. But when we think about disordered eating as a sort of a spectrum, right? Because not all of those who have disordered eating will qualify for an eating disorder. And so oftentimes we look at these areas of flexibility and functioning, meaning, is this someone who, if they went to a family birthday party, would they be able to have a slice of cake? Or would that feel too overwhelming, too overpowering? And so that's where we talk a little bit about flexibility and functioning. Are you leaving class early to go to the gym, or are you unable to complete your activities of daily living because, there are aspects that you're unable to do because your functioning is impaired by your eating, your binging, your purging? And so those are definitely two categories that I always look at when I think about eating disorders in general. But I think the really dramatic sort of statistic we have is that far more people would qualify for an eating disorder than necessarily seek treatment.
Right. Another thing that I talk to people a lot about is how much of your time and energy goes into managing food and body and eating. Because for a lot of folks who are struggling with eating issues, whether they are anorexic or bulimic or have binge eating disorder or simply just are really over-focused on food and body, spend an incredible amount of their time and energy, which doesn't mean that they're not also like getting straight A's. That's often the case too. There actually is a correlation between achievement orientation and eating disorders, which when you think about it makes perfect sense because we live in a culture, an eating disorder culture, that tells us if you're achievement oriented, having the right body is something you should achieve. So that puts people at risk for developing eating disordered behaviors and potentially an eating disorder as well. So for me, that's something I often talk to with people who often feel like, do I deserve help? Like by the time we see them, something is difficult that they have come to us. But they nonetheless often feel like, should I be here? Do I deserve to be here?
Do I need to be here?
Do I need to be here? And my answer to that is, sort of the functionality thing Peggy was talking about, like how is this landing on you in your life? How much of your time and energy goes to managing this that you might prefer to have available for the other things you like to do in your life?
Yeah, I think so many students also struggle with maybe it's an excuse, or I think it's also very real that I don't have time to eat. And so I hear a lot of that. It's it's just not a priority, or, I got so busy, I had to pull an all-nighter, all these excuses. And so I'm wondering how you approach someone who maybe, you're feeling has some behaviors that are not healthy, but they're not really ready to sort of see that as behavior that needs to be worked on.
Well, you always want to start with what is their motivation to want to change something. That just with every person, that might be different. That's what I'm listening for as I get to know someone when they come in for an intake. For someone who's a restricting anorexic, actually usually the first thing that they are aware is a problem is how much of their time and energy goes to thinking about food. They might not be eating very much, but they are spending a lot of time thinking about what they'll eat, when they'll eat, what's safe to eat, how will they get it, how will no one see them do that. So there's a lot of energy there. For somebody binge eating and bulimic, they may be spending a lot of money on food. They may be spending a lot of time engaged in those behaviors. I think we're really looking for what causes them pain, difficulty, strain.
And a lot of who sort of walks through the door for me, they will find other symptoms or behaviors that are bothersome to them, and then perhaps mention some of the disordered eating in passing. And there's oftentimes not that understanding yet of how all of those things are correlated. And so they might come to me for a sleep concern and then reveal that perhaps they typically don't eat after 2 p.m. And so not really sure how that might affect their sleep, or that they're very low energy or very fatigued. And so not quite making that correlation yet. And so sometimes it's also about giving the knowledge, because we also all come from a space where we have so much knowledge in these fields. And I think too often the assumption may be that students have a lot of the language around what is contextualized as normal. And so in their households or in their communities, that may be normal or abnormal, and they may not know.
Yeah, I think that's what I was referring to, because a lot of people that I work with have experienced trauma. And so we're also screening for what their eating is like after experiencing a trauma, because sometimes shifts are normal, but also it's normal for you. And, what's going on for you and how is that shifting and changing as you move forward in your healing. But the other thing I wanted to mention that you were sort of bringing up for me is that what's normal. And I think that one of the things like that I feel like is a misconception that is important to acknowledge, because I think, maybe it's just me, but I think sometimes when people think about people who experience any kind of eating disorder, they think of a certain body type that is going through that. And so I just wanted to like get your thoughts and your experience with this, because I think like we've seen in media representations of someone who has an eating disorder and someone who's very thin, who is, doing certain things. And so I'm wondering like, if you can dispel that myth for us and help us sort of understand that like all different people experience these things, but what your experience is like with that.
Yeah, I mean, absolutely. You cannot tell by looking at someone if they have an eating disorder, no matter what their body size is. We have worked with restricting anorexics who have a body size that is larger than average, and yet they are truly anorexic. And not everyone who's very thin is anorexic. There are normal human variations in body size. And you cannot tell by looking at someone if they're eating disordered, and you can't tell by looking at someone that they're healthy. That's another really important thing. I've known people who may have on the surface looked healthy who were extremely unhealthy in terms of their behaviors, in terms of their metabolites, in terms of lots of concerning things happening with them.
Yeah, and from a medical perspective, not that you could unpack the BMI in an entirely different episode. So, but to say that when a lot of medical professionals are looking at the percentages of who meets criteria for an eating disorder, it's actually far more common to have an individual that is considered a normal, quotations, or overweight, quotations, body size, over someone who is medically underweight. And so it's actually far more common to have an eating disorder within those other two camps.
Right. That's interesting.
Yeah.
And I was thinking the same thing, and thinking about, even our students that see the medical professionals that are part of the eating disorders team, one of the things that we have them do is come in and get weighed once a week. And so I know that some of that is necessary, right? We want to make sure that students are still healthy and they're getting more care than just the weight monitoring. But that is interesting that you're saying that, the scale is only one thing, body BMI is only one thing, yet we still make them do it, and we still make them come and get weighed.
Well, the people who are typically asked to come in and get weighed are people for whom their weight is of potential medical concern. And we want to have a way to track that they are, managing to get enough nutrition that they can sort of working in the positive direction of getting to a place where they wouldn't be medically concerned. I just want to add about the BMI that the BMI is somewhat useful on the low end for when there may be medical concern. It's not useful on the high end. Like the BMIs that are high, you can be an Olympic athlete and your BMI will be above what's considered healthy. And that makes no sense. So the BMI is not useful in that way, and I don't think we use it that way. And also when people come in to get weighed, they're typically weighed blind. Meaning that they don't know what they weigh. Because for so many people with eating problems, it becomes all about the numbers, and they make themselves very distressed by over-focusing on that number in a very unhelpful way. They weigh themselves multiple times a day, which makes no sense.
Yeah. Everybody fluctuates throughout the day.
Yeah, and they experience so much distress around the numbers that really the goal of the treatment is this is not about the numbers. This is about learning to feed yourself in a way that's good for you, good for your body, gets you the nutrients you need, keeps you energized and motivated to live a life that you're enjoying. And the numbers are not important. So people are asked to come in, but it's really only to sort of track
patterns.
And their medical progression really more than other things.
And we also, luckily, at least in the undergraduate space, you typically have access to growth charts, or a lot of students have them from pediatricians or from other primary doctors growing up. And so we are able to really get a sense of if this is sort of quote unquote normal for you, because there are so many variations in the human body to where there are individuals who've been, in the 92nd percentile their whole life, and individuals who've been in the 98th percentile their whole life. And so also not, condemning people that don't fall around that 50% growth chart.
Mm-hmm. Yeah. I'm wondering if you could talk a little bit more about some of the treatment options. I heard Anne, you sort of say that the range from high to low. So I'm sure it ranges based on like where someone comes in, but like what does it look like to work with someone who is struggling with some of these like more severe eating behaviors?
Well, we offer treatment sort of pretty broadly. We have an eating disorder team where we are really lucky to have a multidisciplinary eating disorders team. In addition to Peggy and myself, we have other psychiatric providers from counseling as well as several other therapists from counseling. We have primary care physicians, nurse practitioners, who provide ongoing medical oversight. We have a full-time dietitian who works with the students. We have a primary care manager who helps us manage some aspects of cases if we need a higher level of care for somebody. So on campus, we provide medication service, counseling services. Individual services are, like all of our services, short-term, but we have groups each academic semester called Making Peace with Food, which are basically groups that are designed to help people look at the question, which is kind of the bedrock of how we see it. If each student to explore for him or herself, okay, if my eating problem is not about food, but it's about feelings, because as we talk about with students, I think we grow up in cultures that sort of teach a lot of people that if they have a distress of some kind and they don't know how to manage it, managing your outside, we're taught in our culture, can be a way to think you can solve a lot of problems. So, for example, the two main times of onset of eating disorders are age 13, 14 and age 18, 19. So what's happening at each of those times? Going into middle school, going into college. So in both of those times, you're trying to find your place in a bigger social world, also at a time when your body's probably changing. So we live in a culture.
Out of control.
Yeah. So, and we live in a culture that tells us if you look a certain way, you'll be treated a certain way. And that kind of happens to some extent, at least initially. So it makes a lot of sense that people sort of in struggling around those kinds of issues might look to control how they appear because of how they think that would make them be received and how they can see themselves. So that puts people at some risk. So anyway, so we see those students who've been through both of those times, right? Age 13, 14, 18, 19 have all happened by the time we are working with many of our students. So we do have short-term individual here, but we have the groups which help people sort of look, okay, if my eating disorder isn't about food, but it's about feelings, what does that mean about me? Because the more they understand about that for themselves, the more they have the option to look for other ways of managing those difficulties. And a group can be a really powerful place to explore that, especially the interpersonal side of that, because you have other people in the group with you, both to support you and to give you feedback and all that kinds of things. In addition, we're starting another group up this semester, which will be called the Everybody Project, which is more of a structured opportunity to have three, it's actually a workshop, to have 3 sessions where you come in and you really look at how you feel about your body in the context of culture, and not only how you feel about your body in terms of all kinds of bodies, in terms of gender aspects, racial aspects, sexual aspects. So it's really sort of an opportunity to explore and challenge those ideas, just like we talked about earlier. We also have medication treatment, we have primary care, medical monitoring, and dietary appointments. So all those things are available.
Yeah, and we're very flexible based on both, meeting students where they are and also where their disease process is. And that means that some students are coming in for the first time after years of possibly having eating disorder symptoms. And that might look a little different than someone who for the first time this semester is perhaps experiencing some of those symptoms, and the treatment might look a little different. And so we're also able to refer to higher levels of care if a student feels like that's what they need, or if we've come to that sort of collaborative agreement that that might be best for them. But we really do try to work with students to the best of our ability to provide the care that will allow them to have that optimal
Yeah.
Mm-hmm.
And we're lucky that we're here in New York because there are lots of off-campus therapists trained in eating disorders that we can refer to. And there are several different levels of higher levels of care. There are intensive outpatient programs, day treatments, residential treatments all nearby. So students can remain students sometimes while getting a higher level of care.
Oh, that's great.
Yeah, which we know is sometimes a big barrier to treatment, is this idea that will I have to leave school? And while of course, sometimes the treatment dictates that. For the most part, we really do try to work with students because we know that their health is the most important thing, but that there are, other factors like, student visa status and things that are important as well.
Yeah. I feel like you mentioned a couple times the multidisciplinary team of the counseling and wellness providers, the medical providers, the nutritionists. And I just want to highlight that I think that because you all work together and you all work closely together, that somebody can enter at any of those points and will get connected to the whole team. You're all attuned to kind of pick up on these things and then reach out to one another and kind of make sure that the person is completely covered and will have support from all of those different sides. So I think that's also a great resource of having everything in-house at the health center so that students don't have to go somewhere else and they can kind of just be in that space.
Yeah, and I think, we, and I'm going to speak for the team because I think I can, we really believe in eating disorders being psychological, medical, and nutritional. So it's like three legs of the stool, and unless you've gotten a good assessment with all those things and then have some treatment that addresses the parts of it that you need help with, that's the best treatment. So I think we all really believe that, and it makes it easier. Wherever they enter us, we then can do our best to convince them this is why it's so important you also see the other folks.
Well, I'm curious, when you talk about various different levels of treatment, where is the point in which you would feel as a team that it would need to be a referral to a higher level of care outside of maybe, just outpatient, but maybe there would be some kind of inpatient? Is there a point in which you would refer out for those things? And what does that look like?
Well, it depends on the severity of the symptoms, for sure. And oftentimes students are reluctant to go for higher levels of care. Again, these are achievement-oriented young people, generally speaking. The idea of taking time off from school doesn't appeal to many of them. But, and so oftentimes we will really do everything we can with all the treatment that is available on campus and off campus. And if the person is not able to respond and sort of move in a positive direction after some period of time, that would be when we would say, you're not responding at this level of care. Clearly, what that means is that you need more support, and that's exactly what a higher level of care is. It's a greater amount of support around you as you sort of deal with these concerns.
And I heard you, Peggy, mention earlier about, somebody might come to see you for sleep problems, or they might have low energy and those kinds of things. I'm wondering if there are other signs or symptoms that you all see somebody coming in that may not be aware of an eating disorder, or that they have this eating disorder, and what other signs and symptoms you might kind of trigger a light bulb in you or something to kind of approach those conversations.
So in our initial assessment in psychiatry and our intake, we often ask about appetite, because appetite can be so affected by so many things, right? Depression, anxiety, and eating disorders. And so oftentimes people are very willing to tell you about, their 24-hour diet or, or anything surrounding it when it's, talked about in the form of appetite, because that's really, at the end of the day, the root of it. And so a lot of people tell us, I don't eat very much, but that's normal for me. And so then we dig into, that word normal again of, okay. I typically ask about food patterns in the home. So I'll ask about, who did you grow up in the house with? What did those relationships look like? What did day-to-day look like? And sometimes you can glean, for example, if perhaps there was some restrictive food behavior in the house or things like that. So appetite's definitely a big one. Sleep is another one, especially fatigue. I have many students who come in concerned that they may have attention deficit concerns, so a lack of focus and concentration. And then when we take a look at their nutrition status, we find that they're simply not eating enough to maintain a level of brain functioning that would allow them good focus and control. So because we have, very high achieving students who are, working very hard, studying a lot, oftentimes you can actually see the correlation between focus, concentration, and nutrition.
In our first phone triage on the counseling side, we have a question which is basically, do you have any concerns about food, weight, or body image? Which is a very generic question, and students will answer it, just like they'll answer the one about appetite. And so then really, what do they say next? And if they say, oh, I only eat healthy, well, what do you mean by that? So basically, we sort of follow that, and if we hear things that ring bells, then we start asking more questions.
Yeah.
And these are totally not meant to be trick questions, right? So I don't want students to think that it's like, we're looking for an eating disorder everywhere in the corner.
Right.
But they're very much meant to be, these holistic questions of who are you up to this point where you've come to see us. And it's important for us to be able to get that full circle picture of, in the society we live in, having body image concerns is very culturally it's part of the culture. And so it's not necessarily that, we're looking for things where they don't exist. It's that we're looking, how to optimally help students.
And we're looking to see if those things to contribute to whatever difficulty did bring them in.
Yeah.
Really, that's what we're trying to figure out.
Yeah, I think I do that as well in like my work with trauma. Like you're looking to see like how this person has been impacted by whatever is presenting, right? And so it's appetite, it's sleep, it's focus, it's all of these things. And so you need to dig a little bit deeper when they, say something that is like, yeah, I've lost my appetite. Okay, tell me more. Or oh yeah, I'm not sleeping very well. Okay, let's talk about it a little bit more, right? And so I think it's really important that they do know. We're not trying to trick them.
Right.
Like we just want to see like how they're doing, like how this is impacting them and what we can do to kind of support their goals.
Because they may not realize that, what kind of an impact lack of sleep can have on your mood, for example, or what kind of an impact hunger or malnutrition can have on your mood as well.
Yeah.
Oh, yeah.
Sugar gets such a bad rap, but our brains need sugar to function.
And considerable amounts of fat.
Well, also as college students, I feel like I remember a long time ago when I was in college that like I didn't have the funds to always eat. Like I was running from like a full-time job to classes. And so it really wasn't the priority that it was. And I think sometimes our students really also need to be reminded, hey, you need calories, you need food, you need nutrition in order for you to be able to keep going and keep doing what you're doing. To have the focus, you need to take a break, right? Like all of these things that I think like our students who are, young adults need to be reminded because like they're sort of making these decisions for the first time on their own without having like a parent like in control of some of these things. So just sort of reminding them, hey, got to take care of you.
Yeah.
And honestly, sometimes even coming up with strategies with students is part of the job of, if it's truly just a time concern or you're running around or all of this, how can we help you achieve a level of nutrition that's appropriate within the constraints that you have?
And I'll add that our dietitians know college students and college student life. So they're really good at helping people figure out how to have something to eat while you're running around all day long.
That's great. I'm an adult and I still struggle. Like I think I didn't learn like when I was growing up there was like, we would have like things like SpaghettiOs and ramen and like not the most nutritional things, especially during the summer. And so I think it's taken me a while to be like, oh, fruit, vegetables, protein, like how do I balance all of these things? So it's not something I think that, everybody has like the privilege to be able to like understand and know, right? And so it takes like sometimes like being out on your own and maybe having some hiccups, but also maybe like, listening to others that don't have the healthiest relationship as well.
Yeah. And even over time, like I'm just thinking about when I was in elementary school, we still had the food pyramid and like all of the different levels with the recommended amounts of each of those food groups. And now you have like the plate. Is the plate still a thing? I don't know.
Plate. Oh gosh, it was like 5 years ago.
Yeah, right. When I was in nursing school, my plate was the thing. And so like, but even those messages from people that are doing research and learning about quote unquote healthy eating is changing over time. And so what we're getting mixed messages also in terms of what is healthy and what our bodies need. And so I think that can also be confusing, especially for somebody out on their own for the first time of like, oh my gosh, how do I even create a well-balanced meal? And what does that look like? And what does that even mean? And going back to cost and time and yeah, it's a lot as a college student. I definitely understand and remember.
Well, even as a grad student, I feel like that was still a struggle. Like I went to grad school when I was a little bit older, and I was like, oh, I'm in New York. Things are so expensive here. So it was just, I thought like, oh, I'm an adult. I know what I'm doing. But still, it was hard to get like my nutrition even at an older age. But I'm wondering if you can talk a little bit about like the work that you do when it comes to like body image and eating, and how often like maybe sex comes up as part of that, or how it affects relationships. Because I feel like that's probably, an important part of what you're doing as well.
Yeah. I mean, I feel like a lot of the work, body image, of course, comes up all the time. But, so much of the time, folks with eating concerns, and actually I don't think it's only folks with eating concerns. I think our culture teaches us to view our bodies as objects, as if from the outside, instead of to experience our body as subjects. And that makes for you're looking at your body. You're trying to think of how to control your body or make it appear a certain way. It's all about outside focus. And so often the movement is a wonderful part of life. Sometimes people think, because we work with eating disorders, we're against exercise. We're not at all. Movement is a wonderful thing. It's a healthy thing. It's a good thing for you. It makes people feel good. But, it's a different thing to experience movement from the inside because it helps you feel good than to do it to try to control what you look like from the outside. And, so the same thing with sex, I think, I think it's much harder to enjoy sexual experience if you're experiencing it from do I look okay? Or, if you have a partner, what does my partner think about how I look, as opposed to experiencing it from the inside as a subject. So I think that's often something that can be useful to talk about with folks. I think that's a journey, that's a process, sort of because I think our culture makes it hard for people a lot of times to really experience their bodies as subjectively as opposed to objectively.
Yeah. And just similar to the messages that we get about, about sex, about our bodies, I think too there's a hesitancy to discuss it sometimes. So a lot of times the first, instance in which someone is sitting down to really think about it is with us. And so really thinking about, why am I hesitant to enter into relationships or even, intimate partnerships that are more casual where I'm not really sure, where the hesitancy is. And so a lot of times it's really unpacking that with people of, is it about your body? Is it about, how you're worried how you present? And oftentimes I will have, students who say, I would prefer to be single than to have to even address any of this, or I don't seek out any kind of intimacy because I'm so distressed about, the way I look or, how I feel about myself. And so I think that that's it's interesting because it's sometimes the first time they've ever really thought about it. They'll tell their friends, oh, I'm interested in staying single right now, or I'm not really interested in meeting new people. And then when you really explore it, it's a lot about the self.
Right. Or it's, even what you said earlier, Danielle, it's I'll get on the app after I lose 10 pounds.
Yeah.
I'm hearing a lot of some of the stuff that I work with as well, but that feeling worthy, right? Feeling like you're lovable in where you are right now, and not that you have to get to a point where you are eventually lovable, accepting and sort of validating who you are right now and sort of loving yourself first.
Right.
But as a person instead of an object, because a person, 10 pounds, what difference does that make to a person? But if you're an object, that's a different kind of thing, I think.
Right. Yeah. And also thinking about the idea of, I think sometimes a thought process for somebody with disordered eating is, I don't deserve the food. I didn't exercise enough, or I didn't do XYZ, so I don't deserve to eat. And that could almost translate into the same of I don't deserve pleasure, right? We talk a lot about pleasure coming from sexual activities. And so I'm thinking that maybe that's also part of it, of like, oh, well, I don't deserve to receive pleasure from anybody else because my body is not worthy, or I'm not worthy in that same way. And it's unfortunate because like I love to eat and I love sex, like both of those things. And I wish that everybody had relationships in those ways that they could enjoy both of those things and not have those negative feelings about themselves or their body.
Right.
Yeah. Without that element of punishment.
Yeah.
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 Right.
Yeah.
Yeah, I'm thinking back what earlier you said, Peggy, about flexibility, because so often control is an issue with eating concerns. It's like one of the things like figuring out how to manage being a person, connecting to other persons, being vulnerable with other people, because having relationships with other people involves being vulnerable with them. And if, so I think those are the things that get negotiated 18, 19, 13, 14, and later on in life. And, so it can, that control that can be manifested by control over eating and body, that comes up in relationships, like if you're thinking about being intimate with somebody. And I think sex can bring that up too, or can you feel vulnerable in that kind of way?
Yeah.
And that can be scary sometimes.
Well, yeah, that feeling of judgment, right? Like, will someone judge me for certain parts of my body not being perfect, or will they judge my behaviors, right? Like, is someone going to be like, why are you? I actually had this come up for me. I was on a date once, and I didn't realize at the time, like the person I went out with, I said, I have some eating, stuff. And I was like, okay. But I had ordered macaroni and cheese because it's a good thing to order. And then I also had some bread. And that person was pointing things out to me. They're like, are you sure you want all those carbs? Are you sure you want all of that? And I was like, I'm good with what I ordered. It sounds like you're not. Do you want to talk about it? Because like it was like their like issue sort of coming up within the relationship. And I'm like, I'm not trying to judge you for what you're ordering. I don't want you to judge me for what I'm ordering. Right. And so it's like the challenges within relationships that come up when there are these like differences.
Yeah.
But I don't know that I had a point there. I was just sort of remembering.
I think it also just brings up that sense of deservingness of, okay, here I am with this partner and they are clearly enjoying this meal, and yet here I am unable to even allow myself to let them enjoy it because it's so distressing for me. And so, what that can bring up, in a sexual context too.
Yeah. Oh, I was just going to say, I think like the other thing I was going to bring up is my own bias, and that is because I think that, oftentimes we, and I say we maybe more culturally, not necessarily us in this room, can sometimes like put a gender on who has an eating disorder, and just to sort of name that, like, I think it runs the spectrum of who can have an eating disorder, and it doesn't necessarily mean it's one versus any other gender identities. And so I bring that up because this was someone who was male presenting, and I was like, I don't know that I was like thinking about it in those terms. I was like, oh, okay, yeah, like, you have some stuff with eating. Maybe like you only eat protein and whatever. Like I didn't quite think about it until he was like pointing out those specific things. Like, oh, I think you might have other issues that I wasn't really sort of in my brain thinking of at the moment.
Eating disorders, no limitations of gender, of sexuality, of race. They're everywhere. I mean, one of the things that is sort of maybe a necessary but not sufficient condition is sort of an underweight body ideal. There have been times in Western cultures when the underweight body wasn't the ideal, and there really weren't eating disorders then. The first sort of blossoming of eating disorders happened in the 1920s, when for the first time the body ideal was very thin. And then they kind of went away during like the 50s, when the body ideal was more like Marilyn Monroe, and came back in the late 60s with sort of the era of the very thin models, Twiggy, et cetera. Also like the island of Tonga in the South Pacific had no television until 1990, and they also had no eating disorders. They got television in 1990, and by 2000, their rates of eating disorders were approaching Western rates.
Wow.
Does that mean TV causes eating disorders? No, but it means that sort of an unrealistic body ideal puts a pressure on people.
I feel like there's a correlation.
We do know with the rise of like these very sort of we call them parasocial relationships, but, with a lot of the influencer spaces and Instagram and all these other things that since about it must be 2011, but we know that the mental health, increase with Instagram, that also increased eating disorders. So a lot of times people only talk about the increase in suicidality and depression, but actually with adolescent individuals, it actually increased the rate of eating disorders significantly, because you used to only be able to compare yourself to maybe the people in your community or the people in your school, and now you have people in, a global context telling you what you need to look like. And so that's millions of inputs.
Yeah, there was that big study that Meta did around lowering the self-esteem of young people.
Yeah.
And that's, I think, part of it is, how we perceive our bodies as objects and how that's sort of reflected in, the sort of standard. But in social media, having it just reach various different, places throughout the world and how that has such a huge impact on everyone.
Right. And just to bring it back to our campus, we've had Making Peace with Food groups that were more men than women in the membership. We've had groups that were entirely queer identified. We've had groups that were all except one people of color. So, again, our NYU population, anyone can be, struggling with this.
Yeah.
And I think cross-culturally as well, because, and I know that you work with our global counselors as well. I think it's not just a New York thing. It's not just a U.S. thing. I think I work with students from, all over as well, and just sort of hearing some of the different cultural components. And it's just so frustrating that they're also, dealing with these pressures from family and media to be and look a certain way, and how that impacts how they're, struggling and navigating the world. So to say that it's, we have the, workshop and the group here, but we have counselors throughout the global campuses, and so there's support there too.
Absolutely. And they all work with students who are struggling with eating and body image issues, for sure.
Yeah. I'm wondering about, we do not live in vacuums. We know most of us are not solitary living, and friends and family can also, maybe they're not experts on eating disorders, but maybe light bulbs are going off with certain behaviors or interactions. And so I'm wondering if you could share with us recommendations that you have for friends and family to support and help anybody in their life that they think might be struggling with an eating disorder.
Well, I think I will add that, we work with students who come in concerned about their friends and family, for that matter. So this is something that it would be perfectly fine to make an appointment for yourself at the counseling center to talk to one of the counselors about how to manage this sort of a situation with someone you care about, as well as with yourself, if that's what's going on. But what we really talk with people is sort of approach your friend or person you're concerned about in a comfortable situation that's private, and talk about the behaviors that have led you to be concerned. Like, for example, that food disappears, or this person never comes out to eat with you, or the person always seems stressed out about food, or the person is losing a bunch of weight or gaining a bunch of weight, or their body is changing a lot rapidly. Talk about the behaviors and then say, "Are you okay?" It's not your job or useful to diagnose them, so you don't care if they have an eating problem. What you want to know is, how are you doing? Are you okay?
I care about you.
Yeah.
Exactly. And get them to ask them if they can talk, are you distressed? Because again, we think that the symptoms develop, the eating disorder behaviors come this is an important thing to remember, that nobody ever decided, hey, I'd like to have an eating disorder. The symptoms start as a way to cope with various difficulties. And because of the culture we live in, they're actually successful for a little while, and then sort of the price comes later. So by the time you've noticed these problems, probably the student has some distress going on. So just sort of note the behaviors you've seen, and then express your concern and ask them if they're okay. If you want to add anything to that.
Yeah, no, I was going to say that this also applies for, a lot of students will tell me that they themselves or, friends of theirs quote unquote used to have an eating problem. And, maybe some of those behaviors seemingly are cropping up again. And so similarly, it's also about naming that of, hey, I noticed that you didn't want to go out for, so-and-so's birthday dinner. How's everything going? And really, again, naming the behavior, but also recognizing that someone who, wants to be able to say that they're recovered, that it's not a linear journey and that it doesn't have to be. And so it's also okay to, name behaviors or notice that things are perhaps worsening again, and that maybe that's a sign for outreach too. And that it's okay for family and friends to notice if things are maybe taking a turn.
Right. Make sure they know about the resources that are available on campus. Yeah. And the other thing I would add, and this is we talk about all the time with our students, is that recovery from an eating problem is not a linear process. No. And I say, a relapse is not an opportunity to beat yourself up, which is unfortunately what often happens, but it's an opportunity for you to figure out, hey, I was distressed then. Something was happening. What was going on with me? What was happening that I needed that symptom at that moment? Because it's meaningful that you did need it at that moment. And so look at it as an opportunity to figure out, okay, what was going on and is there another way I might manage that the next time that comes up?
Yeah. And that non-judgmental support, I think, is really, really meaningful for people who are struggling with a lot of body image concerns. Just having individuals that they can rely on for support, but that is also not enabling.
Right, reinforcing all those things.
So not, yes. So not anything where it's, oh, you're okay if I don't eat lunch today, but more so just having the support if they are, struggling to get through lunch, that kind of thing.
Yeah.
And it's hard because it's not like a drug addiction or alcohol addiction, right? You can't ever stop eating food.
Right.
People need food to survive. And so
you have to have a relationship with food. And really the goal is that it can be a good relationship, not just a survival relationship.
Yeah.
But because, food is a wonderful thing. It's how people celebrate. It's how people
take pleasure.
Enjoy. Yeah, it's a real pleasure, right?
Yeah.
So how to have that, that should be a goal, I think.
Yeah. And it's okay to start with neutrality and hopefully get to positive in the future. Because I think too often too they want so badly to be at the finish line, whatever that finish line looks like for them.
Right. And then are self-critical. Like this is where the achievement orientation comes in. It's like, I talk all the time about perfection is the enemy of being your best. And
as a recovering perfectionist, I hear that.
But also what I hear in your tips and strategies for friends and families is really, I think, transferable to a lot of different things, right? Like really expressing like authentic concern in a non-judgmental, safe space to be like, I'm really concerned. I'm seeing A, B, C, D, and like, are you okay? What's going on? And then when they share, to not judge that, minimize that, put that down, dismiss it, all of those things that like we can do, because you can translate that into substance abuse or any other mental health issue or any other like challenge. So I think it's like good advice in general. But I'm wondering, like we've covered a lot today. I wonder if there's anything else that you feel like you want to bring into the conversation that we haven't addressed yet, anything that you think our listeners would want to hear or know about it when it comes to sex and body image.
I can't think of anything.
No, I think just that there's never a bad time to explore either, whether that's whichever one brings you in.
Right.
Yeah.
Right. Oh yeah. So maybe like this follows that, and we sort of said it earlier, but like a lot of times when people come in and they're like, I'm not sure I should be here, or there's a deserve to be there underneath there. I will say, we're here to help you be explore the things you want to explore so that you can live your life to your best. And you don't have to only have a problem. You can come in because you want to explore something because that would be good for you, like you want to do that. So I like to encourage that as well.
Yeah, there's no bad reason to stop by.
And that goes for any counselor, like whether you're at NYU or if you're, maybe don't have NYU insurance or you want long-term service, like anytime, I think it's good to, get good medical care, get good, therapy. We're definitely always talking about therapy and how it can be good whether you're, exploring something specific as problematic, or if it's really just, good maintenance.
Yeah.
Or fuel for growth.
Yeah, we talk about getting a physical. Why can't we?
It's good to have a baseline.
Yeah. Mental health physicals. That should be a thing. Once a year, free for everybody.
And so if someone needs to get connected to like the eating disorder team, like how do they do that at NYU?
They can call the counseling and wellness and set up a 15 to 20 minute phone triage. And usually that can be done within about 24 hours of when they call. Or they can do a walk-in session to the wellness exchange and have a brief appointment with there. And so you would have a brief contact with somebody either in person or on the phone. And then they would set you up for an appointment with the eating disorders team if that was the primary concern that was bringing you in.
Yeah. And on the medical side, too, people can call and make an appointment with the medical provider. I do know that the nutritionist is very busy and she books up very quickly. But I think getting connected to either the counseling services or medical services first will kind of help pigeonhole somebody in to see the nutritionist. I don't know if making an appointment with the nutritionist first is the best use of somebody's time, but maybe connecting to counseling or medical first.
Yeah, I think it's often best medical or counseling first, but again, you can start anywhere and we will get you to everybody.
Yeah. Sounds like there just might be a little bit of a wait for the nutritionist, so you might want to get on the other things too while you're at it.
Yeah. Awesome. Well, thank you so much for being here. I've learned a lot, and
thanks for having us.
Next time we'll talk about BMI.
Yes.
It's been a pleasure.
Yeah. Thank you.
Thank you. If you have questions about the podcast or anything we talked about today, please feel free to reach out to us at goodsex.podcast@nyu.edu. This email address is monitored during business hours and may take 3 to 4 days for follow-up. We are definitely open to critical and thoughtful feedback, as we didn't cover everything in this episode and might have said something that was inaccurate or that had a negative impact on someone. If you have questions about your sexual health and are an NYU student, you can connect with our Student Health Center sex expert at sexpert@nyu.edu or schedule an appointment through the Student Health Center portal. Look at our show notes for additional information and resources, including organizations, articles, books, and videos.
If you have urgent mental health concerns, safety issues, or you are worried that someone might have caused harm to you, or that you might have caused harm to someone, then you can contact NYU's Confidential Wellness Exchange at 212-443-9999. Chat with them using their mobile app or email them at wellness.exchange@nyu.edu. For anyone, NYU or non-NYU listeners, you can call the National Sexual Assault Hotline at 1-800-656-4673, the National Domestic Violence Hotline at 1-800-799-7233, or the National Mental Health Hotline. Simply dial 988 from anywhere in the U.S.
Thanks for listening, and tune in to our next episode where we continue to talk about good sex at NYU. Subscribe to the podcast to hear all of our quickies and interviews with NYU community members. Thanks to our content contributors for this episode, Bernadette Kerr, Alyssa LaFosse, Dr. Dominic Baini-Amisa, Zoe Raguzios, and to our health promotion team, Anna Genova, Jenny Mellum, Parade Stone, and Arna Dixit, and to Gotham Studios and Karen Ortman.